This is Dr. Vinay Director of Surgical Oncology at Fortis Hospital in Manesar in the Delhi region. And in this video, we're going to be discussing the treatment for rectal cancer. So the rectum is a part of our body which is near where the anal passage is, through which we pass motion. And rectal cancer is getting more and more common in our country as well as in the surrounding countries. So this is a big cause of concern. Now, in rectal cancer specifically, it is very important to have what is called a multidisciplinary decision making or tumor board, in which at least a surgical oncologist, a medical oncologist, a radiation oncologist, and in fact a nuclear medicine physician, even a pathologist, these are all welcome parts of a tumor board. Because a patient with rectal cancer, more often than not, will require multiple treatment options. So it's very important to discuss which treatment is required first, which is required after that. So the sequence of the treatment is very important. Most patients, unfortunately, with rectal cancer are already in a locally advanced state. So most patients will usually require radiation first, or chemo radiation first, or chemotherapy followed by radiation, and after that we reassess for surgery. What we are reassessing in for surgery is, do we require surgery, number one? Secondly, if we require surgery, is it going to be preserving the anal passage? A very important part. The patients ask us after the surgery, do I have to have a permanent bag to which the motion comes, or can I have a normal passage of stool? And we specialize in trying our best to ensure that obviously the cancer is cured, but also that the anal passage is preserved. And we do this through what is called sphincter preservation surgery. So we have multiple techniques for intersphincteric resection. We have robotic surgery that is helping us get down, preserve the nerves, preserve the sphincter control. We have a procedure called TAMIS, which is a minimally invasive procedure without forming a stoma. So these methodologies, along with a team, help us to treat patients with rectal cancer with the most accuracy and with the best outcomes, both in terms of cancer as well as the quality of life or the functional outcomes. So in this video, I wanted to impress upon you that a multidisciplinary treatment is required for patients with rectal cancer specifically, and in this way every patient can receive the best possible treatment and have the best quality of life and the best survival after the treatment for rectal cancer. We are seeing more and more patients getting cured of this disease.